Good morning. The next topic is body positions. We'll start first with the general body positions. Okay, so these positions are very familiar to you already. Okay, first we have the erect or upright position. It's basically an upright position, whether to stand or sit erect. Okay, so no illustration is provided for this positioning or general body position. Okay, so when you stand up, when you're in the upright position, where you can stand up in erect position, and then when you sit down, you can also sit down in an erect position. Okay, so next we have supine. The supine is basically defined as lying on back, facing upward. So we have the first illustration here in top nga portion. Okay, can you show the repeat nga area? So the patient is lying on her back. Can also be termed as recumbent, or since the patient is lying on the back portion or the posterior portion is also termed as the dorsal portion. That's why in the recumbent terminology, it is termed as dorsal recumbent, because the dorsal portion of the body is placed in contact with the table. Well, on the bottom part, you have here the prone position, which is a total opposite of the supine position. Prone position is lying of the abdomen facing downward. So if we have the back portion termed as dorsal, we have the front portion of the patient, which is also termed as the ventral. So in the recumbent terminology, we call this as ventral recumbent. Next, we have the recumbent position. So the recumbent position, as mentioned earlier, is basically lying down in any position. It could be prone, supine, and then not mentioned earlier is the lateral recumbent or lateral position of lying down. So dorsal recumbent, basically patient is lying on her back. That is from the term dorsal, or the back part of the patient placed in contact with the table. Okay, ventral recumbent, that means the ventral portion or the front portion of the patient is placed in contact with the table. And then lateral recumbent is basically lying on one's side. It could be the right side of the patient, or could be that the patient is lying on her left side. Next, we have the Trendelenburg position. It is a recumbent position with the body tilted with the head lower than the feet. So this is the head of the patient, this is the feet of the patient. So the head is placed lower than the feet. So in some examinations, in some contrast examinations, this position can be used. So if the radiographic table can be tilted, then we can do a Trendelenburg positioning of the patient. So particularly useful in patients with gastroesophageal reflux disease, in which during this positioning, when the table will be tilted, the contrast media will be allowed if ever the patient has the gastroesophageal reflux disease condition, then it will be evaluated. And then next we have the Fowler's position. Basically opposite ni Trendelenburg, the head is higher than the feet. Okay? So Fowler's position, recumbent position with the body tilted and head is higher than the feet. So it could be that the patient is, for example, in this illustration in which straight lang ang body ni patient, or if ever the patient is in her hospital bed, his or her hospital bed, it could be that the patient is at an angle of 45 degrees from the bed. Muni ang patient lugar kibali dire, diba, nakahigda ang pasyente diha. Or it could be that the bed is at 90 degrees. The head portion of the bed is tilted up to 90 degrees. That can still be considered as Fowler's, or particularly that is a high Fowler's position. Next, we have the Sims position, a semi-prone position. It is a recumbent oblique position with the patient lying down on left anterior side, as illustrated here, left anterior side, and then with the right knee and thigh flexed. So, naka-flex ang thigh, naka-flex pud ang iyang knee, left arm extended down behind the back. So, if the patient is comfortable, you can have the arm on the back portion of the patient, extended at the back part. Or if the patient is more comfortable with the arm nga tuwa sa atubangan, for example in this illustration, then you can also do that. So, modified Sims position as used for insertion of the rectal tube for barium enema, wala diri sa illustration, wala siya na butang, no? Okay, so anyways, a modified Sims position is mostly useful for the rectal tube insertion for barium enema study. So, na-discuss naman natin as yun na to, in which the barium enema or the catheter for the barium enema study will be inserted. There is a rectal canal ni patient through the anus. Next, we have the lithotomy position, a recumbent position with knees and hip flexed, thighs abducted, rotated externally, supported by ankle supports. So most commonly, this position is used for, in the hospital setting, it's usually done in the OB, na department, in which this is the position for childbirth. And in our case, in the radiology department, we can do this type of procedure during hysterosalpingography. That is the contrast examination of the female reproductive organs, in which contrast media will be inserted towards the vaginal canal of the patient, and then contrast media will be allowed to flow towards the from the vagina towards the cervix, and then towards the uterus, and then towards the fallopian tube of the patient. As the next topic, we have body positions. Now we have specific body position. So earlier we had discussed the general body positions. This time we have specific body positions. First, we have the lateral positioning. So lateral position refers to the side of or a side view. Specific lateral positions described by the part closest to the IR or body part from which the central ray exits. So in this illustration, you have a female patient. This is the left side of the patient, and then the right side of the patient is placed in contact with the image receptor. Okay, so whatever side will be closest towards the image receptor, that is the terminology that we will use for the lateral position. For example, in this illustration, the right side of the patient is closer or placed in contact with the IR. So the position is termed as right lateral position. The projection is simply lateral. Okay, and then if ever the patient will be turned 180 degrees, then the left side of the patient will be placed in contact with the IR. Then we will term that as, since the left side is placed in contact with the IR, and again, whatever side is placed in contact with the IR, that is the name of the lateral position. So if the left side is placed in contact with the IR, we term that position as left lateral position. Okay, next we have oblique position. So oblique position refers to an angled position. As illustrated, there is a duha ka picture nasa side. Actually, tulo. You have here this one and this one also, in which the patient is lying at an angle compared to the table. So oblique body positions of the thorax, abdomen, and pelvis are described by the part closest to the IR or the body part from which the central ray exits. So we have 4 oblique position terminologies. We have RPO, LPO, RAO, LAO. RPO, that would refer to right posterior oblique. So right posterior oblique, that means that the right posterior part of the patient is placed in contact with the IR. Okay. So RPO, kani siya nga image dire. Sorry. This is the LPO pala. Wala siya RPO. Okay? So LPO, kani siya nga image dire. Kani, and also this one. So as you can see, the left side of the patient is placed in contact with the IR. Okay? So the left posterior side of the patient is placed in contact with the IR. That is the position of the patient compared to the table. Okay? So when the right side is placed closer towards the IR and then naka-oblique ang body ni patient, so that will be termed as right posterior oblique. Tutan na to, balinasad. Si patient nakaatubang sa table or nakaatubang sa IR. That is the case dire. Kani na si muhang right lower nga image. Okay? So in this picture, in this illustration, the patient, ang iyahang position ani is RAO, right anterior oblique. Okay? So that means that the right side of the patient is closer to the IR. Also, the anterior side of the patient is closer to the IR. And since the body is at an angle compared to the table, so naka-oblique si patient. Okay? So again, kani left and right, whichever side is closer to the IR. Kaning P or A, which portion of the patient, portion would refer to the front portion or back portion, which portion of the patient is placed closer towards the IR. And then O for the oblique, that means the body of the patient is at an angle compared to the table. Okay? So kung mag-atubang ka sa IR, tana to, sige. Try to do this on your own. Higda sa imong katre, hayang. So you're now in the supine position. Okay. So turn your body 45 degrees towards the right side. That means isakan nimo yung left side to approximately 45 degrees only. Diba? Mulingi ka padulong sa imuhang tuo. Pero at only 45 degrees angle. So your body position now will be RPO. That is the right posterior oblique. Kaya nga naman, the right side of your body is placed in contact with your bed. The left side is placed farther from the IR. Okay? So, diba? Your right side is placed in contact with the bed or the table or the IR. That means that is your position. The right side, posterior, and then naka-oblique man ka. So, that is right posterior oblique. In the next, again, di alang yapan si mong bed. Try to face the bed. Try to lie down in a prone position. Naka-prone ka. Okay? And then, once naka-prone na ka, try to rotate your body towards the left side. That means, imong arsahon imong right side of the body approximately 45 degrees. So with that position, you are now in the LAO position. That means that the left side of your body, left anterior side of your body, is placed much closer towards the IR, or the table, or the bed, in your case. So, diba? Kana siya. Left anterior oblique position. Okay? So, for the projection, how do we term the projection? So, it's basically oblique. Okay? Either PA oblique or AP oblique. So, for RPO and LPO nga positioning, since posterior ang naa sa IR, anterior mo'y sudlan sa central ray, so the projection would be termed as AP oblique projection. With right anterior oblique and left anterior oblique nga positioning, the projection would be PA oblique projection, because the central ray enters the posterior and exits the anterior. Okay, so again, we have here the kanisya, diba? Mo man ni si LPO. So question, what is the projection? Since the central ray enters anterior, exits posterior, and then the body is in oblique, so the projection is termed as APO. Okay, so that is anteroposterior oblique projection. Okay, in this image, you have the central ray, lugar dari dapit nga area. Ano siya? So, the central ray enters the posterior, exits the anterior, the body is in oblique position. The projectional term would be PAO, postero-anterior oblique projection. Next, we have the decubitus or decube position. So decubitus is basically lying down in any position, almost basically the same with our recumbent, except that in radiography, we use the decubitus term, we use the decubitus position nga term when we image body parts with a horizontal, or when we image the torso with a horizontal X-ray beam. Yan siya. Okay, so na description na dito sa ubos. In radiographic positioning, decubitus is always performed with the central ray horizontal. Okay, for example, dire, we have the radiography of the torso. You have the abdomen, AP, and then lateral nga abdominal projection. Okay, so the projection remains the same. Entrance-exit gina siya ang projection. Okay, kana sa taas, for example, kani, it enters the anterior, exits the posterior. So the central ray, the projection remains the same. Antero-posterior. There, enters the lateral, exits the lateral, basically lateral projection. But since we are doing it with a horizontal X-ray beam, the term for the position, kani siya, diba? Nakalay siya on the left niya. Nakalay siya on the left. Kani nakalay siya on the dorsal. So, ang atong term ani is left, and then nakatakilid, lateral, term, decubitus, because of the horizontal X-ray beam. Kani sa ubos. Dorsal surface in contact with the IR. So, kani siya, ano ni? So, dorsal decubitus, because the patient's dorsal surface is placed in contact with the table with a horizontal X-ray beam. Okay, so that is for the decubitus. Again, decubitus is always related to or always performed with the central ray horizontal.